The purpose of this press conference was to clear a lot of misinformation that is floating in our community. I understand that the pandemic has put a lot of stress on this community. The pandemic has put a lot of stress on this country. I understand there are a lot of concerns. I understand that there are concerns as it relates to the detention center. And I want to address those concerns. I want to give you factual information. I want to give you clear-cut information, allow you to ask questions and give you the correct information. I was very disheartened when I saw a news feed last week that basically depicted us as to not care or not allow inmates to be treated equally. Last week, we decided, with the recommendation of the CDC and the health department, that we would test every resident, including the staff inside the detention center. And during that process, to prevent cross-contamination, we allowed the residents to stay in their cells for the 72 hours. But here's what I need you to understand, is that during that time, the residents have sinks in every cell, running water, hot and cold water, a towel, a washcloth, and soap. The purpose for doing that was not to punish anyone, but it was to prevent the spread. As of to date, we have 68 positive tests of residents inside the detention center. There's a population of 575 residents. If you do the math, that's 12%. The national average of detention centers and prisons is 20%. We're actually running below that. The precautionary measures that we have taken, that we have implemented, are the measures that have been given us by the health department and CDC guidelines, in addition to one of the leading infectious disease experts in Missouri. As a matter of fact, I spoke with him on Saturday. He applauded us for what we're doing, the steps that we're taking and what we're doing. Every resident at the detention center, we make an effort to make sure that they're treated like human beings, regardless of what they may have been charged with or why they're there. But I felt it necessary to give accurate information to what is going on. The tests are coming back every day from the results, and we're doing precautionary measures to stop the spread. What I'd like to do before I go any further is I would like for our Director of Nursing to discuss some of the precautionary measures and some of the medical procedures that we're taking. As of today, no one has been sent out to the hospital as a result of COVID. No one. So I would like to introduce to you Ms. Williams, who is the Director of Nursing for the Forsyth County Detention Center.
Thank you, Sheriff. Good afternoon. When we did our mass testing over a 2-day period, we tested a total number of 568 inmates or residents at the Forsyth County Detention Center. As to date, as the Sheriff stated, we have received 68 test results. Those tests are positive. We have received a total of 149 test results back as to date. And of those 149, 68 are positive. We are continuously getting test results in as we speak. We are continuously getting test results in as we speak of the 568 tests that we took on the 2-day mass testing days. 64 of those are negative. And as the Sheriff stated, that is less than the national average, which is 20%, so we're at 12% of the national average. Right now, we're waiting on approximately 419 test results to return to our facility. We have not sent anyone out of the Forsyth County Detention Center due to COVID-19 symptoms. So I will repeat, we have not sent anyone out of the detention center due to COVID-19 symptoms. We are doing things to implement or processes that we have placed implementations to prevent the spread of COVID-19. And those things include when patients or residents come into the detention center, they're given 2 masks in intake. When they arrive on their housing units, they're given 2 additional cloth masks. When these patients or residents or inmates, when they lose a mask, when the mask should break, they can also request masks from the officers, and they're given a mask. Each patient, when they come into the Forsyth County Detention Center, they're placed in quarantine for 14 days. So when they are arrested, they are placed in quarantine for 14 days, and they are all tested on day number 5. Every patient is tested on day number 5. We also test patients if they request a test, and we test patients if they say that they are exhibiting symptoms or if they are symptomatic. All they have to do is put in a request, and we will test them due to their request. Each chronic care patient that we have at the Forsyth County Detention Center is given a special mask or a KN95 mask, such as similar to the one that I have on now. When I say chronic care patient, these patients include those patients who have hypertension, other chronic care illnesses such as diabetes, HIV, AIDS, heart disease, etc. Those chronic care illnesses, because we know that they stand higher at risk for contracting any diseases, such as COVID-19 and viruses. We have made it mandatory that all of our staff, when they enter the Forsyth County Detention Center, we do temperature checks, as well as they have to have on a mask when they enter into the building. Staff are also advised that if they have a temperature or any flu-like symptoms, that they must remain at home. Staff are advised that if they exhibit any flu-like symptoms, they must remain at home. Along with these things, as the sheriff said, we're working with one of our leading infectious disease doctors in this area, Dr. O, and we're following all of our local health department guidelines as well as CDC, while we're still providing all of the necessary medical services within the Forsyth County Detention Center. We will continue to provide the utmost care for your patients, our residents, because truly COVID-19, we're all in this together. Sheriff, I'll turn it back over to you.
Ms. Williams brought up an interesting point, and I think it's worth mentioning. Today's count was 575 residents of the detention center. Last year, this time, we was tracking about 800 residents. While the sheriff does not have the authority to go through the cell and release people, you go home, you go home. I don't have that authority. But what we have done since March is we have gotten with the district attorney, the judges, as well as our population specialists. We have went through the Forsyth County Detention Center since March and identified persons who have low bond or low risk factor, non-violent, and have assisted them in getting back home. Today, we have assisted, since March, approximately 500 residents during this COVID. I think that it's worth mentioning that I don't set the bail. I have no authority to set bail to bond. I don't have the authority to release people from the detention centers. I think some conversations are frivolous conversations that I choose not to be involved in, that I won't be involved in. But I want you to know that as it relates to the detention center, we take that very seriously. We take the operation of it very seriously. And as Ms. Williams said, we're doing everything according to the CDC, as well as the leading infectious disease expert in Missouri, Dr. O. Because we recognize the spread of this virus is dangerous. We understand that. And we take that very seriously because all of us, and I'm sure you know someone or a family member that has been affected, and we have been affected as well. So I will pause right there and allow you to ask any questions before I move into the last part of the press conference. Are there any questions?
When was the mass testing? What dates were those? The 72 hours.
The mass testing was on Tuesday and Wednesday.
Yes, sir.
I understand your point that the 12% positive rate would be less than a national average of 20%, but if I'm doing my math right, if it's 68 positive tests and you've only received results for 149, isn't that closer to a 45% positive test rate?
No, we did the rate based on the number of persons that are present in the detention center.
Yes, sir, but it's,
You haven't received all of the test results
No.
of all of the inmates, right?
No,
but you have received 150, and out of those 158, 68 have been positive?
no, based on the numbers.
We have received 149, and 68 of those are positive.
So that's closer to a 50% positive rate, isn't it?
The number is based on the number of residents.
Yes, it was based upon the 568 that we tested.
But out of the tests received, it would be closer to a 50% positive rate than a 12%, correct?
The numbers will probably, I'm sure they will increase once all the numbers come back.
So the 12%, just to be clear, the 12% is 68 out of 575, correct? Or
68 out of
that
the,
have been tested, but you only have test results of 149 out of that 568.
that is correct.
So, but you're basing the 12% on what again?
Of the ones that are positive, right now, our national average in the detention centers is about 20%.
But right now, there are a whole bunch of tests that are still outstanding, so you don't know what those test results will be.
Correct. We do not, we're still waiting.
But as of this moment, we can confirm that 12% of the population has tested positive. As test
Out of
results continue
568 that have
to,
been tested, although you don't know how many of the tests.
right, but we're not going to posit how many are coming back. Right now, we can only confirm that 12% are positive. That number will be adjusted as we receive more test results.
But again, that's only based on 149 test results that you received out of the 568 that you've had tested.
We are waiting on the rest of the test results to come in, and so the 12% is what we can say is currently positive. We will adjust that number as more test results come in.
But of the tests done, 149 tests, 68 have been positive. That would be closer to a 50% positive rate, correct?
If you look at the numbers and the way that you're calculating, that's about 50%. Yes, if you look at them based on that. But the way that the math was done was based on 575.
Gotcha, thank you.
You're welcome.
Are there any other questions for me?
What is your name?
My name is Mrs. Williams. I'm the Director of Nursing.
So Williams, W-I-L-L-A-M-S, what is your first name?
WILLIAMS.
And your first name?
If you want to. If not,
Okay.
you can.
I just go by B Williams,
Okay, and what is your title again?
Director of Nursing.
Thank you.
You're welcome. I saw a hand. Yes, sir.
Yes, Justin with Channel 12, quick question for you.
Yes, sir.
Do you have any idea in terms of a timeline of vaccines? I know it's fairly early. We know the state is getting a second allotment, Moderna this week, or, excuse me, first allotment of Moderna this week.
Yes, sir.
Any idea in terms of when you guys are in line for some of those vaccines?
I just filled out the application for our site for those. I just filled out the application to submit to our health department on, today is Monday, thank you. I filled out the application on Thursday, and I submitted that application. So we should be getting, if I understand correctly, by next week or the week after. And they will be delivered from the health department because we don't have the refrigeration. So next week or the week after.
Are you expecting to vaccinate everybody or just a certain amount, just a certain population first?
The first 1A group, it will go to those healthcare providers or first line people, like nurses, who want it. And not everyone is wanting it.
Quick question.
Yes,
It
sir.
was reported that there was one person who went to the hospital. You're saying that that's false?
One person did go to the hospital, but that was not COVID related as it was reported.
It was not COVID.
Correct. It was not COVID related as it was reported. Any more questions for me?
And when are you expecting the rest of the test results to come out?
As I left the detention center today, we just received a stat, and the administrator is now counting, or reviewing those results as we speak. And we should probably get more this afternoon and so forth until we get our total numbers.
And where does it stand with staff members?
What is the same with staff members?
Yeah, how many staff members
Would you like to
tested
speak?
positive for COVID?
Captain Warren is coming to speak on that.
Good morning, I'm Captain Charlene Warren, I'm Commander of Operations of the Detention Center. Good morning. We have tested 210 staff members, and so far we have 0 that have come back positive, positive. So we have no staff members, new staff members that have tested positive since we tested on Thursday, Friday, and Saturday.
And how many was that again?
210,
210.
yes, sir.
Mike, make sure you understand that. I don't want no misunderstanding. Since the test, make sure we understand it, because I don't want anybody to say, well, we know staff members that have been tested positive, right? Since the test last week of the 212, none have come back positive. But here at the Forsyth County Sheriff's Office, we had to have several people that have tested positive.
So that number stands at 11, the last I checked, the last of the state report.
Exactly.
That's correct.
That's correct. Make sure that we delineate that we're talking about since the testing.
Any more questions for?
I need to say one more thing, okay? And I need to say one more thing, please. Of the 68 that were positive, 2 of those positives, out of those 68 that came, that I reported, 3 of those came into the detention center positive already. 3 of those of the 68 were positive when they came into the detention center,
Okay.
okay?
Question.
Yes.
This is for anyone. Has it been determined what the cause of the spread was?
I'm sorry, repeat that.
The cause of the spread.
So that is why we do contact tracing. So we're in the process of doing contact tracing now, determining what housing units these individuals were on, seeing who may have worked around these individuals, and seeing any commonalities that were associated with these individuals. So that is all a part of the contact tracing. So we're in the process of doing what the source was, or who may have been the source.